All right, folks may still be gathering, but I'm going to go ahead and get us started on our presentation today. So for the first step, Sarah and I will introduce ourselves, but if you are an attendee and you want to just share your name, your organization, where you are, and something you'd like to hear about today in the chat, this has the dual purpose of getting you familiar with the chat, which we hope you will use throughout the presentation today. And we just like to get a little sense of who is here. So if you can locate the chat in your Zoom chat panel and chat to everyone, it would be great to go ahead and see who's here. So I'll go ahead and introduce myself. Hi, my name is Kate Elliott. I work for Comagine Health. I'm our Vice President for System-Wide Quality Improvement, joining you today from our office in Portland, Oregon. And something I'd like to hear about today is what questions you have about our new initiative, the Partnership to Reimagine Health Care. And I'll turn it over to Dr. Woolsey to introduce herself.
Yeah, thanks, Kate. My name is Sarah Woolsey. I'm a family physician and the medical director of System-Wide Quality Improvement for Comagine Health, and I'm based in Salt Lake City, Utah. I'm actually interested in really the priority areas. We're going to share our priority areas today, and we're hoping they align with yours, but we're interested in hearing what's important to you in healthcare quality. So I'll look forward to that part of the talk.
And shout out to Angie. Thank you, Angie, very much for introducing yourself in the chat. I hope others will do the same. I'll just say a couple logistic things. You're all on mute, so chat is really your way to be able to interact with us today. We do also have a couple of polls that we're going to launch. We really would love to get your feedback in those, so sort of be at the ready to respond to those when they come up. We've got some sort of meaty questions in those polls, so appreciate getting your input on those. We're just going to take this half hour today to talk to you a little bit about the Partnership to Reimagine Healthcare and Comagine Health, what we do, how you can get involved, and how you can help and connect others in your community to get involved. So that's a little bit about what is on our agenda today. I see a few more people chatting in, so really appreciate hearing from you all. So I mentioned that both Dr. Woolsey and I are with Comagine Health. Who are we? Comagine Health used to be known as Qualis Health or HealthInsight. Those are names that you might recognize. We're organizations that merged and together, and in our history, we are a national nonprofit healthcare consulting firm. We work across a lot of different areas. We work collaboratively with patients, providers, healthcare payers, and other stakeholders to reimagine and redesign healthcare to make sustainable improvements in our healthcare system. Specifically, what we're talking about today is our role as a quality innovation network, quality improvement organization. That means that we have a contract with CMS to work on quality improvement, especially for Medicare beneficiaries. So we work on a lot of topics that impact older adults in particular. We have served as what's known as the QuinQIO in our respective region for 35 years since the start of the program. So we have a long history with some of you, and you may know us by a different name, but we're here today as Comagine Health. A little bit about, we are starting a new 5-year cycle as the Quality Improvement Organization, and we're doing that by launching an initiative called the Partnership to Reimagine Healthcare. And we're looking to partner with long-term and post-acute care providers, health systems, hospitals, primary care and specialty care providers, community organizations, and patients and families on the quality improvement work that we do for CMS. On the map here, you'll see the states where we do this work. So that is Idaho, Nevada, New Mexico, Oregon, Utah, and Washington. If you are joining us from another state and you somehow found your way here, never fear, you could chat to us and we could happily point you to the organization who does this work in your state. As we think about our role in this region on the map here, really what we do is partner with different stakeholders and around quality improvement topics. We're going to talk a little bit about the topics that we focus on, but our role really is to provide expert consultation and support. Specifically, we do that by sharing valuable curated resources. We like to learn about the people that we work with and then be able to target them to resources that would be really helpful to them to advance their quality improvement priorities. Through this work, we are launching a new interactive portal called Data for Change. And through that, we will provide performance reports to communities and to specific facilities that help them, that give them access to the data that we have and analysis that we're able to do that we hope helps drive some of their quality improvement priorities and understand how their community is doing and how their facility is doing in comparison with others. We will be providing virtual learning opportunities. So we're going to talk about some previous projects today really briefly where that give some good examples about what we hope to accomplish through offering those virtual learning opportunities. And we serve as connectors in our communities. So we might provide expertise or data to community groups that are working on some of the areas we are. We engage community members as subject matter experts in our offerings, and we help connect community members to one another as well. I'm going to ask Dr. Woolsey to talk about the specific areas that we're going to focus on in this new work.
Yeah, thanks, Kate. So our partnership to Reimagine Health Care is part of a national initiative. And the goal of this is to improve the care we give to Medicare beneficiaries. And we're making an impact in these 5 areas. We want to decrease opioid misuse and improve behavioral health outcomes. We want to increase patient safety. We're going to work toward the prevention and best management of diabetes, heart disease, and chronic kidney disease. We want to impact those quality of care, the equality of care transitions, so emergency department, acute transition, post-acute transitions. And then we want all around long-term and post-acute care facilities to have the best quality for Medicare beneficiaries. So in the area of opioid misuse, we want to reduce opioid-related harms through pain management and opioid use best practices. And we'll share some of the work we've done that in the past, and we want to bring that forward. We want to increase access to behavioral health services for Medicare beneficiaries. My guess is that is something that's important to many of you. In the patient safety realm, we're interested in reducing dangerous healthcare-related infections through appropriate antibiotic prescribing, and we want to look at strategies to prevent, track, and monitor infections. We also want to reduce all adverse drug events, all injuries from medications. In the realm of chronic disease, we're interested in really reducing the incidence of heart attacks, strokes, and cardiovascular events. So we're going to target hypertension management, control of cholesterol. We're going to work towards smoking cessation for beneficiaries and appropriate aspirin use. Additionally, before someone gets diabetes or chronic kidney disease, we want to enroll folks in preventive services to prevent those conditions. If people do find themselves with chronic kidney disease or diabetes, we want to improve the outcomes that they get in the progression of their disease. And then finally, we want to screen and refer folks for chronic conditions to the right programs, and those are focused on self-management. In the quality of care transitions I mentioned, we're talking hospital admissions, readmissions, and unnecessary ED visits. Again, crossing all sectors of care. And then with our long-term and post-acute care facilities, you're going to hear repeats. We want medication safety. We want appropriate care for folks with healthcare-related infections and reduce those. And we want to reduce unneeded admissions to hospital and emergency departments. So on the next slide, we're going to launch a poll. And in this poll, we're interested, like I said, to hear about the areas that you are interested in improving. So we have a number of areas, and we know that these webinars are offered to our whole community. So we know there's lots of different perspectives on what's important. I'll read them and think about your top 3. And when you're ready, go ahead and click those in the poll. So are you interested in improving opioid use best practices, increasing access to behavioral health services, appropriate antibiotic prescribing, reducing healthcare-related infections? Oh, and just to mention, if you have a small screen like I do, you can click the little box and it'll make all choices available. I'll continue. We want to reduce healthcare-related infections. We want to improve medication management. We want to improve blood pressure screening and monitoring. We want to prevent diabetes and chronic kidney disease. We want to improve results for people with diabetes and chronic kidney disease, reduce avoidable hospital admissions and readmissions and unnecessary ED visits. And then finally, improve the overall quality of long-term and post-acute care in all those different areas I mentioned. So go ahead and take a vote now. And Janine will let me know as people are taking their votes. And I invite, if there's an area that is important to you that's not there, chat it in. Chat it in. We want to hear what you think. So it looks like our quote-unquote winner is reducing avoidable admissions and readmissions and unnecessary emergency department visits. So that's great. Behavioral health services, another big priority. And then our preventive disease is great. This is a great list. And again, please feel free to chat anything that we didn't hit. All right.
Yeah, I know we have a lot of different kinds of organizations joining us today. So I think really interesting to see that there are some common themes, no matter what part of healthcare that you might work in. So thank you everyone for sharing.
Perfect.
So we've talked a little bit about Comagine Health, who we are and what we do. And so we just wanted to provide some examples about how we partner with organizations to work on improvement in some of the areas that we've talked about. So there's a lot of information on these slides, which you can kind of take in. But Dr. Woolsey, I know last year we completed a project to provide training and support around risky opioid prescribing and opioid-related hospitalizations in a couple of rural communities. Could you just talk a little bit about what we did and what some of the results were that we found?
Yeah, no, thanks, Kate. So working with medical and behavioral specialists, and after listening to patients and communities about what was important to them, particularly in rural areas, we created a suite of materials called Relief Plus. And that stands for Resources Encouraging Lifestyle Intervention and Enhanced Pain Treatment for the 55 plus. So really targeting adequate pain control and safe pain control for people 55 plus. So what did we do? We promoted those evidence-based resources to clinicians. We shared data reports on how prescriptions were happening in those communities. And also we shared data on opioid-related hospitalizations with practices. That helped focus their attention on things that they could do to reduce those harms. You can see that the group set goals around high-dose opioids, co-prescriptions of opioids with benzodiazepines, which is a dangerous combination, and then also those hospitalizations. And you can see that the group set goals that were pretty modest, I would say, at first. But when you look at their results, they were able to double the expected results in their patient populations and really see those reductions in most areas, including the hospitalizations. We have a quote here from one of the facilities. They just really appreciated the support we gave with tools, with data, and then some special assistance and quality improvement. So this is an example of the kind of project that we do in our community.
So another example, I know over the past couple of years, we've worked with several hospital facilities to adopt some best practices around antimicrobial stewardship. So can you just talk about what antimicrobial stewardship is and just sort of what we did to help them?
Yes, so again, I'd like to discuss the origin of this. This came from a request from Critical Access Hospital and rural hospitals to develop antibiotic stewardship program, which is a program that helps us prescribe antibiotics and then track infections so we know what's happening in our facilities, and the goal being to reduce those infections. And through a series of collaborative learning sessions, you'll hear repeats here, collaborative learning sessions with nationally recognized infectious disease experts, best practices from the Centers for Disease Control. So how do you have a stewardship program be successful? You use those core elements. So we gave them collaborative learning to bring up those core elements in their setting, and we saw significant attainment. The results that you see here, Kate, are showing those programs, even though they're in smaller hospitals, lower resource hospitals, they were able to do this with the support that we provided them.
Great, and then looking at another example, I know we shared that a lot of work that we're looking to do under the partnership is around preventing and managing chronic disease. Can you say a little bit about how we have done that in the past and plan to do that in the future?
Yeah, so Kate, I particularly love this work because this is about patients self-managing their conditions and preventing conditions. So in our communities, we support our partners to develop and deliver evidence-based lifestyle lifestyle change programs. And we have two examples shared here. On the right, improving diabetes self-management care. We had over 3,500 beneficiaries attend classes to help them better self-manage their chronic condition of diabetes. And we're really proud of the results. And this was in a diverse number of states and in a diverse number of communities. And on the second side, we're continuing to do this work. This is about diabetes prevention. So we're working with partner organizations to have classes that prevent diabetes. So we help health systems screen patients and offices screen their patients, and then have them, if they choose, enter an evidence-based diabetes prevention program that really has them figure out their way to prevent diabetes. We've had over 1,000 folks enroll. It's a year-long program, so we're excited to see how those results come out. And for that one, I want to stress, National Diabetes Prevention Program has studied to be very effective in the 65 plus. So we're excited to spread this across the states.
And I think what's one of the interesting aspects about this is that we help across sort of the continuum. So again, I know a lot of people from different parts of healthcare participate in our work. And I think one of the interesting things about this is both helping to promote screening, which can then lead to referrals being made, but also helping to make sure that each community has a program, right? So if people are screening and they want to make referrals, but there's no program to refer people to, I think what's interesting is our work on sort of the supply and demand aspect of some of these things. So I don't know if there's anything else you'd add about that, but I just think it's one of the more unique aspects of our work.
No, I think it's a great point, because as many of the folks on the call will know, Medicare is supportive and pays for the diabetes prevention program, and they want folks to have an in-person class. So the onus is on us as your support organization to make sure those in-person classes exist in all the smaller counties and communities across our states. So thanks for highlighting that, Kate.
So our last example is around, we shared one of the broad aims is really to improve the overall quality in long-term and post-acute care facilities. So can you just talk a little bit about, how we do that in this example?
Yeah, I like this example because it's an example of a facility choosing what's important to them. This shows results from a Washington State nursing facility. They wanted to reduce their readmission rate, so RTA, return to acute care, for all payers, not just Medicare beneficiaries, but all the patients that they take care of. So our quality improvement tools, again, our collaborative learning settings, and data reports help them with the kind of feedback they needed to spur this improvement. And you can see here they took their readmission rate from 35% down to 8.1% in April. And the quote here just talks about the facts that they were interested in identifying this improvement opportunity. They identified new processes. They used our tools and training. And ideally, what we want to see is they can do this with other important conditions for them, other important improvement opportunities, so they become self-learners. Anything else you want to say about this one, Kate?
No, I don't think so. I will just note that thanks to Deepthi, who's helping to, when we're talking about a tool, so when we talk about the Relief Plus toolkit around opioids, she's putting those into the chat. So, as much as possible, even when we're working with a targeted group on a specific topic, we try to make those resources and tools available to everyone. And so Deepthi is helpfully putting some examples in there if you're curious about something specifically that we're talking about. And we're also, also if you contact us, we'd be happy to put you in touch with any of the sort of tools that we've mentioned today. So I think we've shared these examples to try and highlight, oh, sorry, Dr. Woolsey, you have one more slide.
Sure. Yeah, I mean, I think Kate, and you're part of this too, feel free to jump in. We're just saying, why join us? And again, thank you for joining us today to listen to a little bit about what we're up to. We're here together to improve care for Medicare beneficiaries, and we want to be a leader in better care at lower costs and really driving care into the community where people are and give them the kind of care that they want. Our services are available at no cost. That's one of the great benefits of the QIO program, is that CMS says this is important, we want to fund this, and we're at your service for no cost. We want you to receive recognition for your commitment to quality. So when you're part of the partnership, you will get credit. You will get to be part of that list of folks that says, I'm here to work with my community, to work with Comagine Health to improve and achieve bold aims. And then finally, this is a network. There are 6 states represented in this network. There are a lot of partners across the continuum. And if we're interested in, our priority is those transitions of care, this is the right group to be talking to, because we're going to see folks from the community, from post-acute care, from hospitals, and we're going to also focus on beneficiaries helping in their homes manage their own conditions the best possible way. So this is the place to be, to connect to all those different groups. Anything else, Kate?
No, I think, you know, you've had opportunities in registering for the session today. We'll talk to you a little bit more about what other opportunities you'll have. But we're looking for people to join this partnership. Joining the partnership simply means saying, I'm in, I'm here, I'm interested, and I want to learn more. When you launch a data portal, when you are starting a project in this area, when you're you know, launching a group on, you know, expanding access to behavioral health services, I want to be a part of that. And so you had a chance when you registered to do that. You know, as someone, if and when you opt into joining the partnership, you'll start to get emails from us to customize what you want to see. So if you're a person that says, gee, we're really focused on this area over here, you'll be able to tell us that, and we'll be able to communicate with you through an email platform that we're launching about what you're specifically interested in. If, however, you have not yet joined the partnership, or even if you're not sure, honestly, I can't remember what forms I fill out in a week, you can do that through the follow-up survey at the end of this webinar. You can also go to comagine.org/partnership, and that link will be in a few slides here, and you can sign up just to make sure that you hear about different opportunities to join us over the next several years. We very much appreciate you, before we go to this, we have one more poll. We very much appreciate you both doing that and sharing that with others who you think might be interested in hearing from us. So we have one more question that we'd really like your input on, and then we'll sort of close things up, and that is, you know, we've talked about the different ways that we offer our work, and we want to know what formats are the best way to get you and your organization engaged. We're all super busy, and we really want to tailor what we offer to what's going to be the most accessible to you. So a really important toolkit's only useful if you can access it and use it. So this is another poll where we'd like you to choose the top 3 about how you'd like to interact with us. 1, do you want customized emails with practical resources that are targeted to your specific interests? 2, are you really interested in the data resources that we can provide on how your organization or community is doing on some of the topics that we've mentioned? C, do you want to get invited to interactive workshops featuring expert presenters? D, would you like to join spaces where you can network with others? So we provide the spaces and really get you a chance to connect with people working on some of the same things. Is it important for you that we produce webinars that you can access now or later, sort of on demand, view those recordings? F, do you want to just be invited to collaborate with others who are interested in similar things? Is what we can do connect you to other people by inviting you to join work groups or committees or coalitions that are working in these areas? And finally, can we help you advance patient engagement within your organization, whether that's maybe starting an advisory council or advising you on how to engage patients and families in your improvement efforts? And like the last poll, if there's something that you don't see here, please feel free to chat it in. That's your designated other box. But go ahead and select those, and we'll just give this a few seconds to close that up and see what people think. Great. Another sort of, people really are interested in getting emailed practical resources that are really targeted to them. Good news, because one of the things I mentioned is you'll get an invite to sign up for our email platform where you'll be able to say what you'd like to get from us in the future. And the data resources, again, once you sign up for the partnership, when there are applicable reports or information available through that portal, we will reach out to you. So joining the partnership gives you access to that. And then definitely some interest in webinar recordings and these interactive workshops and sort of some of these other methods as well. So thank you very much for helping us narrow the field on what we can provide. So just a quick, these were put into the chat, links to materials referenced in this presentation, and we'll send the hyperlinks out in a follow-up email to everybody who participated in the webinar today. So you'll get those in an email follow-up. And then just one last call. If you don't remember, if you opted in when you registered, go ahead and do it again. Go ahead and share this with other people in your organization who might be interested in learning about getting access to some of this information and resources. You can do that by visiting comagine.org/partnership, or for signing yourself up, you can do that through the post-webinar survey that should pop up when we end our session today. Those links are also helpfully provided in chat. So I don't know if there are any questions that we could answer just in our last few minutes. If not, we'd be happy to give people time back in their day.
So Kate, I just want to mention we are repeating this introductory type of session a few more times. So if you have somebody in your organization that it would be useful for them to hear us share, who doesn't know a lot about us, please refer them to the other sessions. Maybe Janine can remind us of the dates. I know there's one Thursday and a couple next week.
Yeah, I think those will go out in the follow-up email to attendees.
Okay.
Is that right, Janine?
Correct.
Okay.
Great.
Excellent. And then I just want to mention there are some folks that just called in and were not able to see what we're showing or see our links. You'll get a follow-up email, we promise, with information, and you can get the comagine.org partnership link, and please send any comments there as well.
Thanks to everybody for joining today. Really appreciate your interest in working with us. Happy to hear from you anytime through that follow-up email or otherwise, and appreciate also any help you can give us spreading the word about the opportunity to get signed up for the partnership. I hope everyone has a great day.
Thanks, Kate.
Bye.